Hey, how's everybody doing? My name is Dr. Franklin Aguiboy, and I'm a dentist. I live in New York City. I actually have a practice in Midtown Manhattan called Smile Design Dental Studio. First and foremost, I know that we're going through trying times, but nonetheless, we shall overcome and have better days. I'm praying that everybody's staying healthy and safe, and most importantly, staying indoors. All right, so we're gonna go over everything that we need in regards to keeping our mouth, our oral cavity in good health during this time, because we want our teeth to be in good health, top notch. By the time, everything is over. So we have nothing but time right now, so there's no excuses. Floss, brush effectively, floss, brush effectively. So let's talk about dental emergencies. So first you have to ask yourself the number one question. Am I in pain? Do I have single tooth pain, wisdom teeth pain? Like, doc, I can't sleep at night. These teeth have to come out. If I have facial trauma to the point where I have facial pain or my airway is obstructed due to it. Do I have an abscess, which is an infection? Like, we have to take care of ourselves. We have to take care of our oral health altogether. So if you're in pain, feel some kind of discomfort, make sure you contact your dentist. Not everything is going to present with pain, but just make sure you contact your dentist or a dentist that's around the area. Now, these are the dentist no-nos at this time. Hey, doc, I just want to clean it. You know those small fillings that you said I needed? Can we do it now? Let's talk about veneers, because I want my things looking real good at the quarantine. Those are not dental emergencies. So now, patients with braces. So essentially, you're going to still be in the same wires that you have been in. Just make sure you're keeping everything very, very, very clean. You can come in for an emergency or at least contact your orthodontist who deals with the braces if you are having some extreme pain or maybe the wires are puncturing your tissues and it's very uncomfortable, some discomfort. And then those adjustments can be done to relieve that pain for you. Our patients with Invisalign, just make sure you're keeping that tray nice and clean all together and you're remaining in that same tray that you've been in. Nobody's mailing you trays because we still have to see everything and see the movements prior to anything. So now let's talk about our daily oral hygiene. Mouthwash. No need to overuse mouthwash. Unfortunately, there's no amount of mouthwash that's going to kill this virus. Unfortunately. Toothpaste. Stick with whatever toothpaste you've been using, whether it be Crest, Colgate, your choice. I leave it in your hands, my friends. We just want you to keep your oral cavity entirely clean, flawless. Get a tongue scraper, scrape your tongue, get rid of all this bacteria. So things are gonna be very, very different in the dental atmosphere. We have to adapt to this new norm. So we have to do, screenings for patients prior to them coming in. We have to see, if they have fever, sore throat, shortness of breath, or, any other symptoms that, we have to be aware for. We have to make sure that we limit the amount of patients that are in the waiting room so we can respect the social distancing. As your oral healthcare practitioners, we're gonna do our part. The personal protective equipment, as the masks and the gowns, we'll have that. The equipment to limit the amount of aerosols as we're doing procedures, we'll have that. Sterilization, we'll do that. Disinfecting of the areas, we'll do that. All we ask is for you to stay safe and prayers and blessings for a better tomorrow.